what do you guys want to do that is like been super hilarious lately for the intro? what kind of hilarious, lighthearted things have been going on for you for the last week or two or so?
Yeah.
Man, I'm just walking into places with my nose and my mouth out, you know?
Mm-hmm. Just dancing on clouds the last few weeks.
It's been tight. I've been loving it.
You know, making good decisions, not catching any virus myself. It's been great.
Yeah, it is a hard time to like try and pluck any levity out of current events, it seems.
It's back to the last 2 years of this show where it's like we did nothing. We talked about nothing but one topic all the time. And even topics that weren't that topic had to tie into that topic somehow. And we're back. We're back to it.
Back.
You know, I had a memory on Facebook come up today that was the three of us, Shannon, Skylar, and myself, 2 years ago, recording an episode together at Skylar's house, which I believe was one of the last ones we did. Well, actually, maybe not one of the last ones, but one of the last ones we did in person before all of this started.
Those were the days.
It is wild that we are coming up on 2 years of this pandemic. That is absolutely insane.
Yeah. We look great.
Yeah. You know, I feel great. So that's cool.
Mm-hmm. Definitely didn't drag myself out of bed for this one today. Well,
it's good to be back, everyone.
Yeah.
Yeah, let's just do it.
All right.
Voices, the things they said. Voices, some from those dead. All the voices heard. Voices, things we say. Voices, they're in your head. All the voices heard.
Hello, everyone. You have Kempa.
And you have Skylar.
And you have Shannon.
And no Flo today. That's the big mystery of the day.
Yeah, Flo, no call, no show.
Which is like, that has never happened, ever. So, you know.
What's going to end up happening, it's going to be a thing where she's like, listen, you assholes, remember when I told you that I couldn't be on the first show back?
Uh-huh.
Mm-hmm.
And we're all going to be like, ew.
No,
there's like
we
half
don't,
of me
we
thinks
were
that
all hammered when you said that, Flo.
We very possibly all could have been completely drunk.
Yeah, that was wrecking my brains wondering if like, did she tell us 2 weeks ago and I just don't remember? And yeah.
Well, hopefully she no call, no showed because she's having a really, really good time somewhere. That is my hope for Flo.
That's what I'm hoping. I hope it's like, you know what? I'm just tuning out, doing,
Yep. They'll figure it out.
Acro yoga with Sheriff Jones, and
that is 100% what she's doing right now.
Yeah,
I think that's it.
Her and Sheriff Jones are like lying there in Shavasana right now.
Mm-hmm.
They're so fucking relaxed.
Yeah. Yeah. Well, now that we figured that out, well, good to see your two shiny faces after a month off. How we feeling?
I mean, not great. It's not been the best. I mean, honestly, like it's been like to be completely fair and not be completely doom and gloom about it. I did manage to see family during the time that we were off, and I flew to, I have family in Tennessee, so I flew out there to see them like basically right when we were starting to hear the phrase Omicron. I was like, well, it's probably okay, and like went out, and then while I was in Tennessee was like, like it felt like it kind of ramped up a little bit. I was like, oh,
Yeah.
I guess I got to fly back.
That was when COVID first hit the US in March 2020. I don't know if you two remember, I was back in Tennessee as well.
Oh, I do remember that.
And I remember feeling that exact same feeling. Like, I don't think I should be in Tennessee right now. Maybe we all have to stop going to Tennessee.
Never been.
Yeah.
So I guess I just won't go.
Yeah. Well, we don't want another one of these. You know, Pi comes next after Omicron. And you know how long that goes.
Honestly,
On and on
what-
and on and on.
here's the
That was
question.
a Twitter joke I saw.
Which one? Well, you know, I think this is maybe a spoiler alert, but Shannon, which one are you holding out for? What's the strain?
Oh, like which one I'm gonna get?
Yeah.
Oh, God, I don't know. I haven't thought the one. I don't know. Why do I feel so on the spot right now? I want the one that's gonna make me money.
Ooh, there's going to be one of those?
I mean,
Well, there might be. We don't know what the new variants
it's gonna
will
like
do.
force me in my house, and then I'm gonna have to like get a OnlyFans, and then I'm gonna make a hell of money.
I was forced in my house for 2 years and I never started an OnlyFans. I don't know if
Some people, everybody got choices, and
bills.
and bills. I don't want any of them. I don't go anywhere. On any of them.
So that I got it. I got the Omarion.
You got Omarion.
Yeah. A few weeks ago. And it was one of those things where like it was starting to surge through California. And I was like, I kind of feel like I'm not starting. Like I probably should go into full hermit mode again. And I was kind of dragging my feet on that and still doing the things I was used to doing now. And I don't know when or how I was exposed, but I got it. And thankfully it was like a very, very mild case. I think I was a little tired for 2 days. I just slept more than I usually do. Like, hey, why am I so tired? I just took a nap 3 hours ago type of stuff. And then I was sneezy for 5 days. So the symptoms for me were different from what people were saying the previous iteration was. Really no upper respiratory stuff for me at all. So I felt
what about
very
taste
lucky.
and smell? Did you get any of that? Like,
totally fine. Yeah, I think.
now?
Yeah.
You never lost taste or smell.
No, so far as I know. Maybe I never had taste.
Or smell. Yeah.
Or smell.
Entirely possible.
And
it would be wild at this point in your life to find out that you've never actually smelled anything and you've just thought that you were smelling things.
That your brain
and then to have
totally
a procedure that
you.
makes it so that you can actually smell things. I think that would be wild. I'm just saying, just for the record, I think that would be a crazy thing to happen.
I would like to put on the record, please.
I think somebody should make a movie about that. Anyway.
And it's just called Taste.
It's just, yeah.
Well, it's like me like
smell.
4 years ago at age 33, learning that I'm allergic to shellfish after describing what it does to me when I eat shrimp to someone. That late in life, making that kind of realization.
Yeah.
Yeah.
Well, I'm glad that you got that it was easy for you, or like easy-ish, as far as things go, because there are a significant number of people who are having a very different experience with Omicron.
Yeah, let's talk about. I mean, this was obviously walking into today going to be one of our central topics today. The Omicron surge, what that means, what it's been doing, right? So as we've seen in California, it has really exploded throughout the state. When you look at testing numbers, the percentages of positive tests, like the last week's average is well over 20%, 22% of tests were positive, which this is comparing to just a few months ago when it was like 2% of tests, 1% of tests were coming back positive. So this particular variant is just blasting through the country. It's very, very contagious. Part of me wonders if it's, the fact that I was sneezing so much, I'm sure that sort of helps keep things airborne, right? Mm-hmm. And, we're finding that it is much more contagious than any previous variant by factors of, I think it was like 2.5 or something.
It feels like more than that, because it feels like I went from knowing like a handful of people who have had COVID to now, like, I'm sure this isn't right, but I feel like 25% of the people that I know have had it now,
Yeah.
Yeah. I mean, I've been a close contact more times than I can count, in January, and we're only 17 days in upon recording this show.
Yeah. Well, I mean, this quickness with which it spreads, it's sort of magnified, because it's like, let's say for every person who gets, Delta, 2 people will get it. And then for this, every 1 person, 4 people get it, then those 4 people give it to 4 people. And suddenly that's just magnified and magnified and magnified.
Right.
But yeah, I feel like the exact same thing. A lot of people I know have been, a lot of folks I know have gotten sick with it. Thankfully, for the vast majority of them, they've been mild cases, which is the other side of the Omicron coin, which is that for a lot of folks, if they're vaccinated, if they don't have, existing conditions with their, man, I really wish we had the epidemiologist on this episode.
Right. I know. I was just going to say too, I think my understanding of it, and another reason why it's dangerous, even though so many people are having an easier time with it, is that this is how variants get created by the thing passing around between people. And if it's transmitting at that kind of a rate, then we're going to have some, my understanding is that we may be on deck for some wild variants coming out after this.
Well, yeah,
a lifetime of variants.
Yeah, I mean, the same way that we have a lifetime of flu and cold variants, right? And
hopefully that will be as bad as it is. But God, I wish Flo was here, because I hear a lot of talk about it's working itself out. It's going to work itself out into the flu, and it will be ever present, but it will just be like a flu season. And people are using that as kind of a reason to be mellow about it. And I wish Flo was here, because I don't know if that's true. I don't know if there's any reason not to think that an even more contagious and very deadly strain is coming next. My understanding is that these things don't mutate in a predictable curve like that.
Sure.
But I'm not an epidemiologist.
What I think towards the beginning of the pandemic, the now canceled New York Times reporter who covered this said that it behooves a virus not to kill its host, right? So hopefully, as more and more iterations come through, the most successful ones will be the ones that don't kill their hosts, because they'll be able to keep hopping to other hosts, right? I think there's a lot we don't know though. And so that doesn't, some years there are worse flus than there are other years. Right. And
yeah, true.
It goes both ways. With this one, with how wildly contagious it was, we are, I think, lucky that it isn't as severe on a per capita basis as the previous variants were, because if it were, we would just be totally unable systemically to take care of one another with the same severity as a Delta, right? Now, all of this is to say, that doesn't mean it's not a terrible surge right now, just because by the sheer numbers of people who are testing positive, which includes a good number of, vaccinated folks as well. Just because those numbers are so high, there are people with immune systems that are compromised. There are people who, have not gotten vaccinated. There are populations that are severely vulnerable who we don't see on a day-to-day basis. Our jails, there is an outbreak in the Sacramento County jails. We don't see them on the day-to-day basis on what they're going through. Retirement homes, places like that. We don't see how quickly it's passing through there. And we're already seeing this week that even if this is a weaker variant, all of the hospitals throughout the state and in our county are already at levels almost equal to the worst of the worst in our hospitals in December, January of last year, right? So,
yeah.
Go ahead.
Sorry. That SACB piece that we read talks about a fifth of Sacramento County's just over 2,800 licensed hospital beds are now being occupied by patients with lab confirmed COVID-19. And I think that that's the thing that is so worrisome, because we have so many folks that are incredibly vulnerable, and to them, this is not a milder illness. This is not a weaker variant. This continues to be, we're going into the second year of a life-threatening pandemic that is just out there doing its thing. But the potential for hospital beds being at capacity because of the rate at which Omicron is infecting people is what do we do if beds are completely full again?
Well,
I mean, that in March or in spring 2020, we dealt with this and there were fewer people infected at that time. Sorry, Skylar, go ahead.
No. I was just going to say, I think another thing that we've said on the show before, but bears repeating, is that the problem, of course, with hospitals filling up and overflowing is it's not just the folks who are dying of the actual virus itself. It's everybody else who needs the hospital for whatever reason, for just kind of normal every day-to-day reasons, and that resource is not there for them. So it's folks who are getting needed surgeries rescheduled. It's
time sensitive things like cancer.
ERs are overflowing right now because everybody's going because they have COVID, right? But I mean, that means that if you get into a car accident, you are much less likely to get the care and the treatment you need in the time that you need it, right? Because every ER is booked full.
Yep. And LA County was finding that already, ambulances are waiting outside their hospitals for 44 minutes right now.
They're doing it's happening here too.
Yeah, and this is just to get folks in the building, and this is far beyond what sort of the general standard is. And let's keep this in mind too. All of this is happening. We're matching all the records from last winter's surge, which was the worst of the worst from what we saw of the virus in the last 2 years. The hospital rates and the death rates, those come a week, 2 weeks, 3 weeks after the apex of a surge, which is we're kind of in the apex of the surge right now. So it's only going to get more crowded in our hospitals.
I think the other part of this is the folks, the healthcare workers who are in the hospitals and get sick with the virus and can't come to work, or now they can because of the new mandates on you can be positive and go to work
after 5 days.
After 5 days,
if your symptoms are improved and you don't have a fever, even if you test positive, you can get back because it's just such an emergency. We need people in these positions. They're just wear a KN95 mask and get back to work. And
the other part of that, I think what reminded me of this is you talking about emergency response. And I mean, I had a situation last week, I think it was, maybe it was the week before, where I had to call medics, and it what was explained to me was we have this many ambulances, which is so many fewer than we generally do. Like, this is not a life-threatening situation. We've got to come up with an alternative to get this person medical attention. Like,
So it's basically like, I'm sorry, no, we can't send an ambulance.
yeah, like, we're not calling an ambulance right away, where we make that determination upon triage. Like, and that's whether or not that continues to be the case, I don't know. And there's also the part of this, which is like when you're working with people, with unhoused folks, there tends to be that like stigma, right? And that like they're not automatically going to do the things that potentially need to be done. But
they won't give them the care that they might give a house person.
Right. But all of that said, the facts of, like, the next day was when the Bee released that report. I think T. Clift wrote it. It was about ambulances waiting outside of hospitals for, in some cases, more than an hour. Like, that's bananas. This is wild.
Yeah,
it is. And it also, the thing that makes it, like, I don't know, one of the things that feels very different this time as compared to the last time that we were spiking really bad and hospitals were filling up is that it felt like the government and the CDC were taking it a lot more seriously than they are now. The CDC more or less seems to have given up, as far as I can tell. This 5-day thing, I mean, I get it. I get, for healthcare workers, like, I mean, I understand the compunction, but for everybody else to send out the thing that, okay, yeah, 5 days, whatever, wear a mask if you test positive, is like,
I mean, didn't they?
Like, I feel like
they benched
like
to an airliner asking them to do that, right?
Yeah, isn't that, it's the CEO of Delta, I think.
Great. I hope it's not Delta.
Ask for
Is
that?
it Delta?
I think it might be Delta. I don't know. Don't take my word for that, though. It might not.
So
I'm gonna get rid of that Amex now.
We talk about this, these rules that are changing with how folks can return to work and how the CDC is managing, or in my opinion, mismanaging this pandemic. And this, what my experience has been thus far is that with the current variant, the rate of transmission is so high, and because of that, so many people are going to test, right? The PCR tests, so labs are backed up. So you're testing on a Tuesday, potentially not getting your results back until a Saturday, and you're asymptomatic, but on Saturday you get your PCR test results back and you're positive, and you've just been living your life. You've just been doing the thing
because you had no symptoms, and
because
that's
you
what
had
they
no
said.
symptoms, right? And it's such a giant clusterfuck of, like, the shit show is beyond. It's beyond. I just can't.
It's a massive systemic failure. And it's like, there's plenty of blame to go all around. Obviously, I think it goes all the way up within our country to the president, right? But
real quick, just as a thought exercise, what do you think the narrative from, like, the New York Times would be right now if Trump were the president?
Exactly.
Yeah,
exactly. And meanwhile, when the Biden administration says these things, folks give him the benefit of the doubt, even though he's making a lot of these decisions based on the same thoughts Trump had over, like, well, we got to get businesses up and running again. This is going to hurt my approval rating if we don't get the economy moving again.
Right.
Like,
well, two things about this. This is when the left was yelling at the libs in the last primary about, like, if Biden gets elected, you gotta stay engaged, and you have to stay on top of him. You have to pull him to the left. If you guys just go to brunch, things are gonna go to shit. Here we are.
Here we
right?
are.
This is a great example. I mean, it is like, you know, it's a wild ass, crazy, once in a lifetime event, right? The pandemic. But like, it really, really underscores how, like, if you treat politics like sports and you just pick your team and you just back up that team no matter what, that is how we get into situations where like Biden is doing. But I legitimately don't think that, like, in terms of pandemic response, Trump would be doing anything that different from what Joe Biden is doing. But people are just kind of like, well, I guess that's how it is, rather than being pissed. And they should be pissed. Like, the last time things were spiking this bad, we were doing stimulus checks, and like the government was like reaching out to be like, hey, like, here's how, like, let's do what we can to assist you so that you can stay safe. And that has completely just shifted into like, throw yourself into the grinder and sacrifice yourself to the economy, which is exactly what Trump would be doing. It's just wrapped in a blue flag now, so people aren't pissed about it. You know,
he's less yelly, and the things he says are less like headliney stupid.
Right.
I mean, that's it. It's systemic failure. It is failure on a grand scale from top to bottom. And it speaks to our for-profit private medical industry. One thing, I guess, that when you look at, California has a very robust COVID tracking page, covid19.ca.gov /state-dashboard. And on this, it does show you that vaccination, it's very important to get vaccinated. Like, I don't want to forget that with folks. Mm-hmm. You're much more likely to get this variant, even if you're vaccinated. I am case in point, right? But it's still, if you're able to get vaccinated, it will protect you so much more than if you're not. The COVID tracking page says currently unvaccinated people are still about 4 times more likely to get COVID-19 than fully vaccinated people. Unvaccinated people are 8 times more likely to be hospitalized with COVID. Now, this is during a time when you're going to be fighting for a bed right now, right? And then on top of that, unvaccinated people are about 21 times more likely to die from COVID-19 than fully vaccinated people. So I also just want to drive that all home there, because there's a lot of people, some people even in like the progressive circles, like just saying some straight up untruths, saying like, why did you get vaccinated? It doesn't do anything. Oh, it does something, and it can save your life. Right.
It's not black and white. It's not either or. It's not you get the shot and you're completely safe. It's like everything else. It's more nuanced than that. And it's on a spectrum. And it just, if you get the vaccine, it moves you into a very different area of the spectrum of danger that you can expect to be in if you contract the thing,
Yeah. My so a friend of a friend is a nurse here in the county, and her whole floor is overrun with COVID patients now. And she had a guy come in who's like pretty young, like late 50s, really nice guy. And after a few days of him being there, he got kind of pensive and quiet. And he said to her, like, I listened to the wrong people. And he's like, as soon as I'm out of here, I'm going to get vaccinated. And he didn't have a chance to. He died a few days later. And like, I don't think we should spike the football the way that a lot of the neolibs are doing on this stuff. Like, I don't know. Like it stuff like that is just like, it's really sad to me, because these are a lot of regular people that just the outlets they chose long ago are the ones that told them not to do it, and now here they are.
Again, politics is sports, right?
Yeah.
I
think one of the I mean, there's a lot of dangerous messaging out there, but one of the really dangerous things that I've heard from progressives is that very thing, which is don't why, like, I don't know why I got this vaccine anyway, because I got COVID, like from people who end up with the virus. And it's this like inability to connect that prior to a vaccine, like the likelihood of you dying was through the roof, right? If you got the virus. And the vaccine has created a situation where you can recover at home, where many people can recover at home, certainly not everyone, and where the symptoms are in some cases quite mild for people. And I like that, the vaccine being the golden ticket to you being able to live your very comfortable life, I think is like the thing that we need to like shake out, because it's not like, as long as there are hundreds of thousands of millions of people suffering to make it like through this pandemic in spaces that are rich and poor, this is not like we got to figure out a way to be in this together, which I know is a fucking long shot, because it is, for all the reasons that we do this show, it's a long shot. But I don't know, I think in all of this, it's like, if there were a magic wand that couldn't cure the virus but could get rid of the virus but could do something, like making sure that there was like succinct and effective messaging around vaccinations would be among my top choices.
Yeah. Well, I don't know if there's like a call to action on this. We all know the drill. We all know what we should be doing during a surge like this, right? And I guess the only good news we have is this variant, and with a variant that moves this quickly, the speed at which the surge came should be matched, if what we saw in South Africa is any indicator, with the speed with which the surge will go down, because honestly, there's only so many people who can get it at this point. That doesn't mean we're not going to see a whole lot of very difficult scenes at our hospitals in the coming weeks. But
what do you mean there's only so many people who can get it?
Well, it just, people get it at such a rate, and the, like we were seeing, I think over the average over the last week was like 22.3% positives on the test. I think it might have been more recently something much, much higher on a given day, even locally here. It just is. It's blasting through communities where everyone's exposed. It doesn't mean everyone gets it, but everyone is exposed. And, there's a lot of people who did get it, who are totally asymptomatic, who will never get tested. And I believe that is how it went through South Africa, which is why the surge, it went so high so fast, and then it went back down so fast, because once so many of us, I already got it, 3 weeks ago, right? So like, even if it's bouncing off me out in the community, I'm not going to get it. And then I won't be able to give it to other people again. And sooner or later, it just dies out like that, right?
Science is wild.
Yeah. I do remember in the New York Times, did the little balls bouncing against each other, and they changed each other's colors. Yeah. I'm like a gray ball now. I don't matter in this situation anymore.
In this one, but we'll see once we get to once pi rolls around.
See in 90 days. Yep. I know. So any positive notes, any affirmations or calls to action at this point? It's 2 years in. Like, what do you say?
Any affirmations?
I know. I know. I had an incident where I went to a gathering, and it was outdoors, but I got the word that someone there had tested positive. So I went and got my PCR, and while I was waiting for the results, and also my partner Frida had somebody test positive at her work, and we found out about the same time. So we went and got PCR test on Monday, and we didn't get the results until like Friday afternoon. So we basically quarantined under the assumption, that kind of that you have to be under that, like I have this thing,
Right.
until you get your results. And man, I like going back in and sheltering in place again, even just for 5 days, was like torturous for me. I really had like a difficult time with it, and like weirdly difficult. Like I was kind of like, why am I this upset about it? And I do think a lot of it has to do with burnout, right? Like a lot of it is just like, come on, are we still doing this? Like,
Yeah.
I don't know. It's a bumpy ride, and like, and who the fuck knows where we are on the ride, in terms of being towards the beginning or the end, I don't know.
When I got it, Chelsea, my partner, had to quarantine with me, obviously. I believe we both had it. And I made it through those days, just like basically annoying her for 5 days straight. And she was a great sport, but yeah, I don't think she can handle a second round of that. So I hope. I don't want to get this. I don't want this to come through again. I'm so tired, you all.
I know.
Yeah,
I think.
I
I mean,
really,
I
really,
think
really don't
that's
want it.
kind of how everybody feels, and like, fortunately, I think we're in a community of people who are like, even though we're tired, we should still do the right thing. But there are a lot of people who are like, you know what? I'm tired of this.
Yeah.
I'm done with all precautions,
Mhm.
And as long as there's folks who are doing that, I think this is gonna be how it is,
Yeah. Well, and that, I think we did as best we could without our resident epidemiologist today. I don't think it was terrible. I think we did pretty well.
I'm sure she'll tell us.
I hope so.
Yeah, that'll be the next episode.
Yeah. Like,
With
here's
Flo just, like,
everything.
Here's all the
playing
shit
this
you got
episode
wrong.
back and just being like, pause. This is wrong because X, Y, and Z.
Like, literally everything you said last week was incorrect. We look forward to that, Flo. This topic, obviously, it shows us a complete systemic failure. I think it shows us a failure also of our electoral system, particularly on a national level. It shows us the complete abject failure of a for-profit medical system, where people who deserve care have been afraid to go and get it. And even when the care is free, or when a thing is free, like, let's say, a COVID test, people are still afraid to go get that because they don't believe it. They're so used to hidden costs. They're so used to getting blasted with like $600 for nothing, right? That there's a very important piece of legislation going through California in our new spring session that I thought tied in very nicely with our initial conversation here, and that is universal single-payer healthcare, AB 1400. I believe that was introduced by Assemblymember Ash Kalra, one of the real ones, one of the real progressives up there at the state capitol. And really good news. Last week, it passed through the Assembly Health Committee. And you never know with these committees. A lot of these conversations are behind closed doors. They let things die in committees so that they don't have to vote on these things, especially something like this, when it's capitalist Democrats whose, bread is buttered by the health insurance companies. So when it's going through committee, that's when it's really in danger of dying. And it passed. I believe the vote was 11-3. It passed through the Health Committee for the Assembly. It is now going through the Assembly Appropriations Committee, And I believe that will be Thursday, January 20th, that we'll see what happens there. And if it passes through appropriations, which appropriations is scary, that's always where bills go to die, because the question is, can we afford it, right? That's what appropriations is about. And a lot of people in those committees just let these things die if they just don't want to vote on it. But this is another committee. That's another 14-person committee, 10 Democrats, 4 Republicans. It should be a home run. Ostensibly, it would be a home run, but we know what California Democrats and what Democrats in general are like, right? When someone pays for their campaigns, they're going to do what they want them to do. That includes these for-profit insurance companies. Can someone just like briefly talk about like, why is single payer important? Because Governor Newsom came out saying like, hey, I've got this great thing. We're going to make it so undocumented people can have access to healthcare. And everyone's looking at that and they're like, well, I mean, yeah, fine. But like, we're trying to pass single payer right now. Like that will cover all of that. Right.
Right. I mean, let me start out by saying that my bitter, pessimistic heart is warmed by how well AB 1400 seems to be doing. I mean, I'm going to be honest, I am shocked to see it doing as well as it is doing. I still am too much of a cynic and too distrustful of California Democrats to think that, to be like getting ready to celebrate on it. But I think it's a good step that it's gotten this far and that people are going for it.
Yeah. You know, single payer is, I guess I just wanted to say like, what is it, right? Because maybe not everybody knows what it is. It is basically that every member of the community pays in their taxes to a, sort of massive, like, this is all going towards our collective health, our healthcare system. And once we all do that, then every time you walk into a doctor's office, no matter what you're there for, you pay for nothing.
Right.
Ever.
It's like, I think the easiest comparison to make, and maybe there are things about this that are inconsistent, but to me, the easiest way to describe it is that it's like the police or fire, right? Like, it's just a thing. If you need it, it's there, and they don't, the cops don't give you a bill after they come to your house. It's just covered because we all put into the pot.
Yes. I mean, that's
kind of how that works.
That's a great way to put it. Even if you hate cops, like, you get it, right? Like, right. A huge chunk of our tax dollars, as we all know, thanks to the, Sacramento People's budget, goes to the cops in our city. Now this is for, public safety, quote unquote, but like, this would be on a state level and for health. And honestly, the vast majority of it would be paid by our billionaires and our multimillionaires in our state. So yes, it would take a bigger chunk of your money out of your paycheck, but also you and your employer would not be paying for an insurance provider.
Right.
And in the end, a system like this allows us to do proactive medicine, where we're taking precautions for ourselves when it's like, hey, in my family, sometimes people get skin cancer. Then I start proactively going to the dermatologist because I'm not afraid of hidden fees or anything like that. Then the dermatologist finds something very small, excises it, and now I don't have to go through years of, like chemotherapy or something, right?
Right.
This is something that in the long run, it is smart financially. And the only reason we as a country in the United States are the only like major global player that does not have single payer is because we are the most, really the most distorted, vile version of capitalism that the world has ever seen. And so our private insurance industry maintains this system so that they can profit off of our ailments.
Yeah. I mean, another thing that it does for everybody immediately, I mean, for one, like, being like thinking about American healthcare versus healthcare in like several other, countries of comparable economic status is embarrassing. Like the way like if you are like go anywhere on the internet where like there's an international discussion happening around healthcare and people feel bad for us.
They can't fathom what we go through here.
Right, exactly. It just seems like barbarism, and it is. I mean, and that is the correct way to feel about it, because it is. I mean, another thing that people like in Canada, for instance, don't have to deal with is that like a huge reason why people get stuck in jobs that they don't want to be in is because of healthcare. Because like somebody's wife is sick and needs care, and their healthcare is tied to their work.
Right.
And it just it tethers people, and it gives your work even more power over you. And this is another thing. I mean, just as a worker, that makes you more autonomous, and allows you to pick work based on whether you want it versus whether you need it. Right.
Yeah.
I think like the frustrating thing about all of this is the continuation of uplifting like universal healthcare as the thing that we should aspire to, when like access to healthcare is cool, but having it paid for is cooler. Like, right? So
access to healthcare is thoughts and prayers, the Democrat version.
100%.
It's like it's
100%.
completely meaningless. It's like, no, we're just going to keep doing the same thing, but
Right.
they'll have. It's like affordable housing. Like
totally
like what does that even mean? That's a completely meaningless thing to say.
It's like when because you still end up with these like premiums and out of pocket expenses and like your
means
co-pays
testing,
and
like
all
am
of
I
that
poor enough to get this, or am I too rich to
Right.
get this care?
And your
It's
employer
backwards.
can also then can like, depending on how shitty they are, they can then choose like a healthcare package that is technically affordable because it only costs a certain amount per person. But if you were to go to the hospital, it's going to cost you, the worker, so much more than it ever cost them. Right. So like there are so many different angles that a single payer system just works better for people, right? Or that was a terrible sentence.
And we're working out the kinks. Our first episode
I
back.
guess I've forgotten how to speak in the month off. Just that there are so many different ways that we can unpack the benefits of a single payer system for everyone, like including the asshole gazillionaires, right? Like you get to keep your money, dude. Like, sure, we all have to pay higher taxes, but those taxes don't hit you the same way as they hit any of us anyway. So
we're still paying.
When people are like,
paying,
when people complain about paying higher taxes, I'm just like, but you don't have to pay insurance premiums,
right?
Like it's
right.
It's like, I don't understand how that doesn't compute for people.
Who do you think is paying the bill for the ambulance ride for the unhoused person who's having an emergency right now because they can't do proactive care?
Or all the uninsured people who just have to use the emergency room as their only like access to a hospital because of how the system is set up and can't pay for it.
And they will never be able to pay for it. Who do you think is paying for that? It's coming back to
we
all
already
of us.
Pay for each other. Right.
Yes. Yeah, totally. Let's talk a little bit about what's happening in the Capitol building then. Governor Newsom came out with that one thing saying like, hey, we're going to help expand healthcare for all these folks, when he's obviously trying to do this sort of like shimmering thing in front of the fact that he's afraid or refuses to. He goes to dinner at like French Laundry with these insurance company CEOs, right? Like, he doesn't want to support single payer right now. And so he's bringing this thing forward, just saying like, hey, isn't this nice? And like, really what folks should be saying is, no, it's not good enough. This is not what you wanted. That's not what you promised. It's definitely not what we wanted. He promised when he first ran for governor in 2017, he was saying this, that he was going to fight for and achieve single payer healthcare in the state of California. And now he's stepping back on that. And honestly,
well,
if
and he also got a lot of people to go out and campaign for him. Like all the nurses like got in buses, drove all up and down the state to campaign for him because he was running on single payer healthcare.
Right.
And do not mess with the nurses. They will fuck your shit up.
They will come for you.
So he's doing it. He's trying to mess with them. And he knows he's in a good political space because he already beat the Republicans on the recall election. I would really like to know, is there a good progressive that we could trot out to challenge him in his election this year? I want to see somebody who is fighting for single payer. We need someone who could push him left, But in the meantime, the way to get to this, I think, is taken to the streets, which is not easy right now, which I understand. And I do think that increasingly taking to the streets is going to be the thing that will sway politicians. You let them know how many more of you there are of them. You let them know where the will of the people is, what issues that they want to get passed, because Gavin does not care what you want. He cares what his buddies at French Laundry want. And, the next thing to do, especially with something like AB 1400, also keep an eye on ACA 11, which is how we're going to pay for AB 1400. Basically, we're going to try and get that out there, hopefully around the same time. But if we pass AB 1400, we force the issue with him. So it gets on his desk and he has to decide, do I sign this or not? And that puts him in a very impossible position. Because if he vetoes it, he's a fucking liar, right?
Yeah, but that's also that's like Democrat 101, right?
I mean,
is
you're
to
not wrong.
Campaign on a bunch of shit, get elected, and then be like, never mind.
That's why I said that. I said that second to taking to the streets, because I think this will be less effective than taking it to the streets. Like, we need to show like a massively the power and anger that people have right now, But yeah, I mean, once we get a good idea of who's voting which way on this, like it always helps, it helps for us, like when it came down to rent control. Then we started seeing people's true colors. Now we know who the dick bags are, the shit bags, Democrats who are really on the sides of the landlords and who aren't, right? And I think with something like AB 1400, that allows us to do the same thing, assuming it gets to the floor, which I really hope it does.
Yeah. Yeah.
So, I mean, I guess the biggie, the call to action for folks is to reach out to, if your assembly member is on the Appropriations Committee, or even if they're not, just reach out to all of them and let them know that you want this to pass, you want this to make it to the floor. Like I said, there's 10 Democrats and 4 Republicans. I won't say all their names because there's many of them, but that's worth doing. I can put it in the show notes. But beyond that, I don't know. Any other call to action? That's kind of just where that is right now.
Yeah.
I mean, I don't really know. I think it's just kind of, I mean, I think the best call to action is just to like pay attention and
totally
watch, like understand what is going on right now, because this is a big deal either way, Keep it on your radar and make sure it's on your friends' radars.
Yeah. There's a quote going around. We are recording this on Martin Luther King Jr. Day, right? Monday, January 17th. There was a quote floating around in like a lot of California circles where he said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I think that's like kind of an important thing to remember in that conversation. When we talk about the inequities in healthcare, those inequities are very often an economic issue. And when it's an economic and like a class issue, it is 100% falling down along race lines. And when it falls down along race lines, it also falls along lines of immigration status, right? All of these things are intertwined. And that's why this is just a supremely important thing to pass, especially in a time when we're seeing that our medical system's failed. It's failed us completely. Yeah, I mean, do we want to, like, we've got a couple more minutes. Is there any, like, do we want to talk a little bit about MLKJ?
Yeah, I was just going to say, you know, I don't know. I don't want to be another like white dude in 2022 who's like pontificating about the teachings of Martin Luther King Jr. But one thing that I would like to do, just in case anybody has not heard it, is just quote this little snippet from letters from the Birmingham jail. Just to put it out there, I'm gonna quote this quote in the way that he said it, as it came out in the letter specifically. I have almost reached the regrettable conclusion that the Negro's great stumbling block in his stride towards freedom is not the white citizen's counselor or the Ku Klux Klanner, but the white moderate, who is more devoted to quote unquote order than to justice, who prefers a negative peace, which is the absence of tension, to a positive peace, which is the presence of justice. Like, honestly, this quote sums up this quote sums up a lot of my frustration with Democrats and the libs. To be, I mean, I don't think there's any more concise way to put that. And the reason I wanted to read this is because, like, I don't know, this just seems like it gets more and more relevant every year, you know?
Yeah. It's funny how many neolibs or folks who call themselves progressives, but obviously when push comes to shove, pen comes to paper, they show their true colors. They're willing to quote him, but like, what were they saying 2 summers ago during the George Floyd protests, when these young people took to the streets and were not messing around and did, you know, force the issue? What were these politicians saying about them? What were they doing? Were they calling them domestic terrorists? What, like, did they sick a violent police force on folks? And I'm talking about like locally, I'm talking about throughout the state and throughout the country. And yeah. And again, another white dude talking right now, but like, it's just,
I think it's also like, you know, you watch like, you know, Selma or whatever, and nobody sees themselves as like the virulent racist who's like standing on the side and like throwing glass bottles at protesters and sicking dogs on people or whatever. But like, I don't know, like, I think everybody, and now that like Martin Luther King has been like, you know, kind of made into this big legend, and it's like the only socially acceptable opinion to have about him is that he was good. Right. So like, even if you are like kind of a whack racist lib, you have to at least act like you know, like the I have a dream speech, you know. But really, I think like if you want to know what you would have done back in the days that Dr. King was active, like if you want to know who you would be in that movie, it's who you were during the George Floyd protests. Like if you were critiquing the protesters and being like, look, I know that like, you know, this stuff is really bad, but you know, there's got to be a better way to do it. And I don't know what that is, but I know that this is really bad. And, you know, like if that's, you would have 100% been opposed to Dr. King in his time as well. In my opinion. And now as Now I'm pontificating as a white man on Martin Luther King Jr. Day. Sorry, everybody.
I know I was like going to ask a question like, well, what about the people who said like, you know, he preached for peaceful protest? There's like a James Baldwin quote, right?
Yeah.
Where Baldwin was like, you know, for that to actually work, you have to believe that the state has a conscience. And I think this state is resoundingly showing it does not. But yeah, anyway.
He also said a riot is the language of the unheard.
I mean, that's the thing, right? It's so, this is like MLK Day is the day that we get to see a bunch of white folks and white libs take quotes out of context without remembering that Dr. King was an anti-capitalist. He was not for the military. He was an anti-racist. He was
a proponent of universal basic income. Like
yeah,
they used to call him a communist.
Right. I mean, this is a guy who is for people over profit. Like,
yep.
And there's I saw a lot of folks who are local to Sacramento who were quoting Dr. King today. And if they actually took some time to sit down and unpack what his phone call would be like to a council meeting, I don't know if they'd be quoting him.
Yep. You know, I just on a broad level, I'm looking at the year ahead, and I think there's going to be a lot of things happening that will continue to force people to show their true colors, and to show what side of history they're going to be on. And so I couldn't ask for a better group of co-hosts and a better community than the rabble rousers in Sacramento to watch this happen with. So here's to a 2022 with Voices, and everyone who listens, just thank you so much for all you're doing. And thank you so much, I don't know, for just being out there every day and paying attention to the things that are happening and letting us know when we miss stuff too, because it's just so important. And we can't do any of this without you.
Heard that.
Should we call it?
Yeah, I was gonna say, speaking of doing great work, Dave, where if I wanted to see more of this Great Voices content, where on the internet would be a good place for me to go to find such?
That's a fantastic question. I'm glad you asked me. The place that I like to go is called voicesrivercity.com. That's where you find all of our current iterations, our current episodes, our podcast episodes. We're also doing the SAC Follows the Money project, which will follow local races and who's giving money to whom in those races, right? So is it developers? Is it, is it a cop? Is it the cannabis industry? We're trying to compile that so you have a good idea of who you will or will not be electing in the upcoming elections. And there's a lot of big ones this year. It's 2022. We are going to see a new city council. It's going to be a different city council by the time this year is over, which could potentially be a good thing. And we could change the face a little bit of the County Board of Soups. Obviously, there's state races as well. We're trying to pay attention to all those things. I'm getting a little off track. We are on the socials. We're on Facebook, Voices River City, Instagram and Twitter at Voices River City. If you want to support us for as little as $5 a month, patreon.com/Voices River City. It helps us do a lot of the things like pay for our subscriptions, really just give us access to the things we need access to so we can tell the stories that we're able to you every week. And then what else? I am on Twitter at UNOKEMPA, YUKNOWKEMPA.
I am Guillotine for You. That's Guillotine the number 4, YOU.
I am Shan N.D. Stevens. Sorry, I swallowed
Is that a
lint.
burp?
I think I
No.
swallowed a lint, a piece of lint.
And
And
then
Dr.
you can
Flo.
find Flo, John. Hopefully, if anybody can ever find Flo again.
Where in the world is Dr. Flo?
At Flo Jean, FLOJAUNE.
And that's it. Thanks, folks.
Yeah.
Welcome back.